Hello all, good morning. My name is Dr. Shashivardhan Janjirala. I am working as a consultant interventional cardiologist at TX Hospital, Banjara Hills. So today we are going to discuss regarding the need of bypass surgery, that is CABG versus PTCA or PCI or percutaneous angioplasty. That is nothing but keep putting a stent into your coronary blood vessels. In our heart, we have three major blood vessels. One is left anterior descending artery, the other is left circumflex artery, the third one is right coronary artery. So depending upon the angiogram and the patient's presentation, we usually tend to calculate a score known as syntax score. Basing on the syntax score and the patient comorbidities, like patient is fragile, elderly patient who couldn't be able to tolerate major surgeries, big surgery and all, to those kind of patients, we tend to stratify the patient between bypass surgery versus coronary intervention, percutaneous coronary intervention. So if a patient is being given option of two things, like either you can go for bypass and go for multivessel PCI, so that itself indicates that both the procedures can be done with equal good outcome. So initially when the guidelines were formed, we haven't had the luxury of all these latest sophisticated equipments. So today, these days, we have an intravascular ultrasound, we have a OCT, we have IVL, we have Rota, we have Rota Pro, we have orbital atherectomy. There are so many gadgets in the market through which we can recanalize and revascularize the blood vessel adequately. So coming to the bypass surgery, so usually what they do is they bypass the normal blood vessels which is given by the God, and we put a artificial bypass tract from the aorta to our coronary blood vessels. We usually take the arteries. Those are usually what they take is the Lima artery, left internal mammary artery, for the arterial graft, and there is something called as venous graft. So for the people who doesn't know the difference between artery and the vein, if you palpate your blood vessel, means pulse here, whatever you are palpating is, that is artery. And by this time, I think every one of us has gotten ourselves with a venous cannula. The one with which we put a cannula is a vein. This is a softer one and this is a stiffer one. So the stiffer graft which they use for bypass has got longer patency. It lasts for around 10 to 15 years, and the venous graft lasts for 5 to 7 years usually. So it's not like a hard and fast rule that this stays only for 5 to 7 years, but an average period is around 10 to 15 years for the arterial graft and 5 to 7 years for the venous graft. So basing on that, you will be advised whether the graft will benefit you or whether the stent will benefit you. So, and there is something called hybrid approach. For them, we do both stenting followed by single vessel grafting. It's a complicated thing, but it needs detailed discussion with the patient and their attendants and what they are willing to get it done. So all in all, if you take regarding the outcome of the patient, for the patients who are left main coronary artery, who has got the disease in the left main coronary artery, they will usually benefit from bypass surgery and also the complex anatomy, where we cannot put a stent. The way we feel that the stent doesn't do the justice, then the doctor himself will tell you that go for the bypass, that will benefit you more. For the cases where you have got both the options of stent versus bypass, the doctor itself will discuss the options with you, so which one is better for you. So the common question which comes from the patient is it okay to put 3 to 4 stents in a single patient? The usual guidelines tell that only more than 2 patients needs to go for the bypass. It doesn't hold true these days. We have kept 4 stents, 5 stents also in multiple patients. People are doing wonderfully fine. They come to our OPD walking in a good shape, good health. There are so many people who doesn't want to get a bypass done because of the multiple complexities involved in it. Patient needs to get the general anesthesia, he needs to get intubated, he needs to stay on the ventilator, he will go on the pump. There are so many things which he needs to take into consideration before going for the bypass. So there are so many patients which have kept 3, 4, 5 stents, and these patients are doing wonderfully good and coming back to our OPD happily. So there is no hard and fast rule that more than 2 stents needs bypass. There is nothing like that. It all depends upon the anatomy, and the doctor clearly discusses with you. Then only you should, or your family should come to a final conclusion that okay, we will go ahead with this. Thank you.